Assalamu alaikum. My name is Mustafa. I am the final year student. These are my group members. So let's start with the examination of the skin, hair and nails. So this is the integumentary system consists of the skin and accessory structures, hairs and nails. First, let's go quickly through the skin anatomy. The skin is the largest organ in the body, making up 16% of the body weight. It protects the body from the external factors and keeps the skin organs intact. Skin has three main layers: epidermis, dermis, and a subcutaneous or subcutaneous. Largest organ of the body, protection from the environment, temperature regulations. These are functions of the skin: synthesis of the vitamin D, storage of the fat and blood, excretion of waste, sensation, composed of the epidermal and dermal layers, along with the subcutaneous. So, some major functions: perceiving touch, pressure, temperature, and pain via the nerve endings, protecting against the mechanical and the chemical, thermal and solar damage, protecting against loss of the water and electrolytes, regulating body temperature, repairing surface wounds through cellular replacement, synthesis vitamin D, allowing identification through the uniqueness of the facial contours, skins and hair color, and the fingerprints. Oil or sebaceous glands produce sebum that is usually released in the hair follicles. Other functions being the barrier against the chemicals, particles against the mechanical injury, microbes, ultraviolet against the loss of the body fluid radiation. It plays role in the homeostasis, regulation of the body temperature, sensation for being the touch, pressure, temperature, and the pain. Mobility provides a surface for the grip. Metabolism, role in the vitamin D productions, immunity against outposts for the immune surveillance. Regarding psychology, sexual attraction. Now let's move to the hair. These are the thin fiber compound of the dead keratinized cells, vellus and the terminal. Hair has a protective and the sexual function, and hairs covers the surface of the skin, except for the glabrous skin of the palms and soles, the glans penis and the vulvus introitus. The follicle density is the greatest on the face. The hair shaft has an outer cuticle enclosing a cortex of the packed keratinocytes. There are three types of the hairs: lamigo, fine and long, found in the fetus; vellus hair, short, fine, and light in color, cover most body surfaces; and the terminal hairs. These are long, thick, and dark, found on the scalp, eyebrows, eyelashes, pubic, axillary, and the beard areas. So these were the three types of the hairs. After then moving to the nails, thin plates of the keratinized epidermal cells that cover the distal ends of fingers and toes. So this is regarding the structure of the nails. This is the body of the nails. These are the lateral folds, this being the lanula, and this is the cuticle. These are some points regarding the examination of the skin. First being, use a room that is well lit and has a full length mirror. Have a handheld mirror and chair available. Remove all your clothes. Examine all skin surfaces front and back. Begin with your hands, including the spaces between your fingers. Continue your arm, chest, abdomen, pubic area, thighs, lower legs and toes. Next, examine the face and the skin. Make sure you inspect your underarms, the side of your trunk, the back of your neck, the buttocks and the soles of your feet. And sit down with one leg elevated. Use the handheld. So, removal of the clothing before the examination. Removal of the clothing, jewelry, cosmetics, wigs and hair pieces. So let's start from the general examination. Examining the skin is a part of the general examination. When you examine the hand or face, note any abnormalities of the skin. Ensure a warm, well-lit private place is available for the examination of the patient. Offer a chaperone. Record the chaperone's name, or if the patient declines the offer. For widespread lesion, ask the patient to undress to his underclothes. Use a hand lens to examine the individual lesions. A dermoscope using a 10 power magnification illuminated lens system is helpful for the pigmented lesions. So now we will start examining the patient. Note the distribution of the lesions. Pick a typical individual lesion and check size with a tape measure if need to be. So these are some specific things we should be looking at: shape, color, and the border changes.
Dr. Hassan, you can stand on the left side of the patient where you can see the slide clearly. And when is your turn? When will you start?
So after this slide, they will start.
He will start?
Yes, he will start. So if any pigmented lesion or mole has been recently changed, note that the distribution of the pigment within it and whether it is inflamed or ulcerated. Malignant melanoma commonly shows a variation in the pigmentation and has an irregular or diffuse edge. Remember ABCDE, asymmetry, border, irregular, color irregular, and diameter more than 6 millimeter enlargement. Examine the skin, entire skin, as abnormal moles are more common in the patient with a malignant melanoma. Regarding the nails on hands and feet, different areas of the scalp, ask the patient to point to the problem to localize, then part of the patient's hair to see mucous membranes. Examine local lymph nodes in any patient with a potential squamous cell cancer, malignant melanoma, or cutaneous T-cell lymphoma. Take a skin scraping for microscopy and culture if you suspect any fungal infection. Start examining the patient.
Assalamu alaikum. I am Dr. Hassan, final year medical student. I am going to examine you. Will you allow me?
Yes.
Okay. Your name, please.
Farooq Ahmed,
Your age.
24,
Okay. Occupation.
student.
Okay. Can I know you? What brings you here?
Skin problem.
Okay. Can I go? We are examining the nail to looking for colonacia and clubbing. Just look normal. Okay.
These are some abnormal skin findings: primary and secondary lesions, vascular lesions, purpuric lesions, infection, malignant lesion, and ABCDE criteria. ABCDE criteria being A for asymmetry, B for the border irregularity, C for the color variation, D for the diameter greater than 6 millimeter, E for evolving changes. In evolving changes include changes in the size, shape, symptoms, itching or tenderness, surface bleeding, and any shades of the color.
This ABCD criteria is very important for the skin lesions. A is for
So A is for asymmetry,
asymmetry, D is for
border irregularity,
irregularity, C is for color variation,
And diameter.
and then D is for diameter or size, diameter, and then evolving changes E. A, B, C, D, E for the skin lesions diagnosis. Yes.
Yes, sir.
These are some of the pathologies or
Yes,
diseases
sir.
where we can find
Where
the
skin lesions,
skin lesions.
Tinea, measles, varicella, herpes, psoriasis, dermatitis, eczema, and impetigo.
So let's talk about some of the terminologies used to describe the
Skin
skin
lesions.
lesions at the sham.
So first of all, abscess. Abscess is a localized collection of the pus. Next being the atrophy, translucent and wrinkled skin, visible loss of epidermis, dermis, or both, thin blood vessels. The third one is bulla, a fluid-filled blister more than 5 millimeter in diameter. Burrow, a tunnel in epidermis caused by a parasite, for example, a caries in scabies. Callus, local hyperplasia of only layer on palm or sole due to the pressure. Comedo, a plug of sebum and keratin wedged in a dilated pilosebaceous orifice on a face.
Is it comedon? Comedo?
Comedon.
Okay.
Crust, dried exudate, for example, serum, blood, or pus on a skin surface. Next being cyst, a nodule consisting of an epithelial-lined cavity filled with fluid or semi-solid material.
So difference between bulla and cyst.
Yes, sir.
Bulla is fluid-filled
Blister more than 5 millimeter in diameter.
Cyst or nodule consisting of an
Epithelial-lined
epithelial-lined
cavity,
cavity filled with fluid or
semi-solid
semi-solid
material.
material.
Okay. First, we have to check the eyes for jaundice or erythema. So, normal. No one is saying. Can you write this? Okay, no rashes found. Yes, look normal. Can you open your clothes? Okay, it's look normal. So,
So these are the other terms: ecchymosis, erosion, erythema, excoriation, fissure, freckle, lichenification, and macule. Other terminologies being the papilloma, papule, petechiae, plaque, purpura, pustule, scale, scar, ulcer, and the vesicle. Some other terminologies. So these are the pictures regarding the measles, chickenpox. You can check psoriasis,
we look for psoriasis.
impetigo. So this is regarding the papule and making of the plaque. Papule and the plaque. Nodule or tumor, vesicles and bulla. These are the chymosis or bruise on the skin, purpura.